Today we're diving into a really powerful op-ed from Senator Edward J. Markey and the former head of the CDC, Rochelle Walensky. And they ask a question that's, well, it's pretty unsettling. Is the United States actually getting sicker?
And they don't ease into it. I mean, this is the opening line. It's a stark, arresting claim that just sets the tone for everything else. This one sentence is the entire foundation of their argument, that our public health isn't just treading water, it's actively getting worse.
So who exactly is making this pretty bold claim? Well, you've got a sitting U.S. senator and the person who was literally running the CDC from 2021 to 2023. Their combined experience, from the halls of Congress to the front lines of public health science, gives their perspective a unique kind of weight. Let's unpack it.
All right, so to back up a statement that big, you need some evidence, right? The authors get right to the data. They start laying out a case built on some statistics that are, frankly, alarming, especially when you think about diseases we thought we had under control.
This scale of the problem gets real fast with this first number. The op-ed says the U.S. has seen over 2,200 measles cases in 2025 alone. Now, just to put that into perspective for you, this is a disease that was officially declared eliminated in the U.S. way back in the year 2000. So that kind of jump it's staggering.
And we're not just talking about a little uptick here. The authors make it very clear that this is the highest number of measles cases this country has seen in more than 3 decades. They basically frame this as a huge historic setback that puts our whole measles elimination status in jeopardy.
And look, it's not just measles. They also point to the really severe impact of the seasonal flu. As you can see here, this season alone has meant around 340,000 hospitalizations and, tragically, over 21,000 deaths. So the point they're making is that this isn't a one-off. They see a pattern developing across different diseases.
So why do Markey and Walensky think is causing all this? This is where they pivot from the what to the why. They argue the root cause is a systematic dismantling of the country's public health system.
Central to their whole argument is this phrase they use, the anti-science movement. Now, this is how they describe the policies coming from the Trump administration and Health Secretary Robert F. Kennedy Jr. They define it as an approach that just actively ignores what they call decades of established scientific fact in favor of conspiracy theories.
And they give a really concrete example of what they're talking about. They point to the recent CDC decision to cut 6 vaccines from the recommended childhood schedule. Then they put that right next to the prior standard, noting that just one of those vaccines, the one for hepatitis B, prevents 17,000 infections in kids every single year.
The authors, well, they really don't mince words. This quote right here just captures how strongly they feel. They're arguing that calling these policy changes reform is totally misleading, and that the actual consequences are incredibly dangerous and, in their words, deadly.
And beyond these immediate outbreaks, the op-ed warns about something deeper, a more systemic kind of damage to the nation's health infrastructure. They argue this crisis is getting wider and could have consequences that stick with us for generations. One of the huge issues they bring up is this brain drain. They claim that mass dismissals of federal employees at critical agencies like the CDC and the Department of Health have led to this devastating loss of expertise and institutional memory. The very people we need to fight diseases, both old and new.
And this timeline here shows another big worry they have: cuts to the National Institutes of Health, the NIH. They use their home state of Massachusetts as an example, drawing a direct line from 18 clinical trials being defunded last year to 13,000 patients being directly affected today. And the future? They predict it's going to slow down medical innovation and drive talented people out of the field.
And here is a really startling picture of that talent pipeline problem. The article says that less than half of the available infectious disease fellowship positions were filled last year. That means we are not training nearly enough new specialists to replace the experts who are leaving or retiring.
So why does a shortage of these doctors matter so much? Well, the authors connected to some pretty severe real-world problems. They're predicting everything from delays in cancer care and riskier organ transplants to being weaker against antibiotic-resistant superbugs and, of course, being less prepared for the next new pathogen.
Okay, so after painting this pretty bleak picture, Markey and Walensky don't just leave us there. They end their piece by shifting from the problem to what they believe is the solution, and they lay out a really clear path forward for the country. And their whole call to action is built on this one core idea. They argue, really forcefully, that public health has to be taken out of the political arena. As they put it so memorably, viruses don't care how you vote. They say the health of the entire nation really depends on this.
So to fix all this, the authors give Congress a 5-step roadmap. It's basically defend our federal health agencies, empower the scientific experts, bring back funding for medical research, protect independent scientific decisions, and actively work to rebuild that public health workforce.
The op-ed ends with this powerful parting shot, a clear play on a very familiar slogan. It really serves as a final urgent plea, summing up their belief that the current path is just incredibly damaging and that we have to change course for the country's health and its future.
And so, that brings us back to where the authors started, with this really critical question about where we're headed as a country. After seeing all their evidence and their arguments, it's something to think about, right? What does a truly healthy nation look like, and what's it going to take to build it and maintain it?